Next item that we have on the agenda is House File 3712 from Representative Hicks. If you'd like to come down to the testifier table.
Remind folks as they're moving to be quiet.
Yeah, and as people are moving out, if you could hold it down so that we can continue on. I do know that this bill here, 3712, also has a number of testifiers, so we will be limiting testimony on that part of on this bill also when we get to it. Representative Hicks, would you like to move your bill?
Yes, I would like to move my bill, but I also have an author's 1A amendment.
Okay. Representative Hicks moves to re-refer House File 3712 to the Human Services Finance Committee, and you have an A1 author's amendment. If you'd like to move it and explain it, please.
Yes, I move to approve the A1 author's amendment. The amendment adjusts the makeup of the proposed task force to ensure that provider representation is not overpowering the representation of people accessing the service, and adjust the timeline of the task force for appointments and first meeting to ensure the department has time to implement it.
Okay. Thank you. Members, are there any questions or comments on the author's A1 amendment? Hearing none, all those in favor of the author's A1 amendment signify by saying aye.
Aye.
Opposed, say nay. The motion is approved and House File 3712 is amended. Representative Hicks, to your bill.
Thank you so much. In front of you today is House File 3712, which looks to delay the implementation of adult family foster care rate tiers and creates a task force to study these proposed tiers and the impact the changes would have on the individuals currently living in the service. We last session passed legislation that removes this service from the waiver rate system and establishes flat tier rates for the service effective 2026. As these are being looked at by providers, there's growing concerns about what they may mean for the future of the service. This bill does not change what we did, but it delays the implementation till 2028, giving more time for a task force that involves providers, individuals receiving the service, and the department to look at the rates and make any necessary recommendations. With that, I will look to my testifier to give more detailed information as needed.
Very good. Before I start with the testifiers, I'd like to remind testifiers that we have 2 minutes each, and also want to let the committee know that we had a number of people submit letters to us that are in your packet. Please make sure to review those. And with that, we will start with Sarah Grastrom. If you'd like, welcome to the committee. Please introduce yourself and begin your testimony.
Thank you, Chair Fisher and committee members. And I will take like 75% of my testimony and slash it and speak off the cuff a little to meet that 2 minutes. So for the record, my name is Sarah Grafstrom, and I am the Senior Director of State and Federal Policy at ARM. Representative Hicks already did a really great job of kind of explaining what was passed last session, so I'll just hop into some of our concerns with the flat tiers as passed and what we're hoping to accomplish with this legislation. So as, you know, our family foster care provider members have many concerns with these proposed rate tiers. First, there's an uncertainty as to what an individual's new rate will be. The rate tiers that have been published were based on data from 2017. These will need to be revised before final rates are published, and the revised rate tiers are based on Min Choices 2.0, which continues to be delayed, further delaying the release of the final family foster care rate tiers. Because rates are not final, widespread notification of the changes have not been made to family foster care providers across the state. With a proposed effective date of January 1, 2026 for the new rates, it's troublesome to not have the data that those rates will be based upon and to know that many providers are not aware of this change coming their way. ARM has reviewed the current proposed rates using the 2017 data, and initial modeling of those rates shows drastic rate reductions for some family foster care providers, resulting in many providers considering shutting their doors and no longer providing this important service. With over 1,200 family residential providers in our state, the loss of even a few represents a major loss to the network of providers who do this work. So as Representative Hicks said, we are proposing to delay the effective date of these rates, pushing it back to 2028, allowing family foster care rates to remain in the disability waiver rate system until that time, and also proposing a task force to really look at what is being proposed, study it with providers around the table. I saw you hit your phone, Nick, to tell me time is up. And so with that, Mr. Chair, I will stop there and be happy to answer any questions.
Thank you for your testimony. Thank you for being so prompt on your time there. Next testifier we have is Jason Steck. If you'd like to come forward, please. And after Jason Steck, we have Angela Strasser. Welcome to the committee. Thank you for taking the time to be here. Please introduce yourself and begin your testimony.
Thank you, Mr. Chairman and members of the committee. My name is Jason Steck, and I represent a organization that was formed actually just yesterday in the Minnesota Association of Residential Services Homes. And I want to just take a few seconds to identify what MARSH is. MARSH is an association of small, often home-based providers of family residential services and adult foster care services and home community-based services. And MARSH members are particularly alarmed by some recent proposals, including the one that we're addressing here today for the tiered reimbursement rates, but also some other policies that have been imposed by DHS, all of which they feel could make operation of their family residential services businesses flatly impossible. My role here today is mostly just to offer information from the perspective of these small FRS providers. As small providers, these family and home-based businesses are particularly vulnerable to proposals like reductions in their reimbursement rates. Adult foster care providers, as the committee knows, is limited to 4 people in their homes, and it's a 24/7 job, meaning that if the reimbursement rates are cut, they simply can't operate anymore. They'll go away. They will simply disappear. They can't do the job, especially since they can't supplement it with other income. They're a 24/7 job. So the concern that MARSH members have is simply that the new reimbursement rates would make this industry go away almost entirely, because the adult foster care providers would simply disappear, as it would be economically unviable for them to exist. So the MARSH members are pleased to see the formation of the task force, and they're looking forward to contributing to the process. Now, I'd also like to, I come here today to introduce the next people who are the MARSH board members, and that is Sandra Donahue and Angela Strasser.
Okay. Thank you so much for your testimony. Next person then we will be going to will be Angela Strasser, if you'd like to come down. And then after Angela will be Sandra Donahue, if you'd like to be ready. Thank you for taking the time to be here this afternoon. Please introduce yourself and begin your testimony.
Chair Fisher and members of the Human Service Committee, thank you for allowing me to have the opportunity on behalf of the individuals we support and all family residential service providers. My name is Angela Strasser. I, too, am a current ARM member, and we appreciate the work they are doing. Please refer to my written testimony that I've already submitted. We have been told over and over we are not a business initiative, yet we are held to the same 245D compliance rules and regulations. The statement, "we are doing this out of the kindness of our heart," is inaccurate. Are we passionate? Absolutely. However, we must make a livable wage as we work 24 hours a day, 7 days a week, 365 days a year. Small providers such as I are the most vulnerable. We do not have endless financial resources to be supported. Sometimes we are not viewed as a necessity. If the new tiered system is not reevaluated and providers are forced to accept the rates that were passed, 70% of all family residential service providers will close their door. In calculation, this is approximately 3,300 individuals that we currently support. Is Minnesota ready to take that on? Where will the individuals we support go? If they are lucky enough to find placement, who will support them? Will these supports be person-centered? Will their culture be recognized and honored? Every individual has their own culture, which must be identified and supported, because it takes dedicated support staff who are committed to building relationships with each individual to identify what their culture means to them. It takes many years to build trust and to build relationships. Family residential service providers are the trust and stability. In 2017, we were faced with a direct care workforce shortage. The Olmsted Subcabinet told DHS and the Department of Employment and Economic Development to form a multi-agency work group, in which they did. Their number one priority was increase worker wage and her benefits. The strategies within that was livable wage. If you look at the governor's budget, the flat tier is not a livable wage. It offers the highest tier that's proposed, $12.66 an hour. So what I want to say is, now I'm getting short on time. Yesterday, we did form the Minnesota Association of Residential Service Homes, and with that, we would like to have a seat at the table. We would like to be part of the task force and be considered for both adult foster care and home and community-based services. So on behalf of the individuals that we support and all community family residential service providers, thank you for the time, and we appreciate the support.
Thank you. Thank you for taking the time. Next, Sandra Donahue, if you'd like to come down, please. Thank you for taking the time to be here today. Welcome to the committee. Please introduce yourself and begin your testimony.
Thank you, Chair, and thank you, members of the committee, for allowing me to testify today. My name is Sandra Donahue. I have been a provider for over 20 years. I appreciate the delay to 2028 for the flat rate system and the proposal to create the advisory task force, but I do not support the flat rate at all. In 2020, DHS wrote a legislative report on family providers and the DWRS rate system. They said we are unique. We are. I agree with that. We provide the same services as corporate settings. However, we also provide an extended family to those we support and to their families. We become their family. We are unique, but we shouldn't be penalized because we provide those services in our homes. The report addressed costs that make us different. I challenge that. Like corporate settings, we have the same rules. We have the same mental and physical health challenges in the people that we support. We have the same need of hiring supplemental staff for one-on-one programming and awake staff written in their individual support plans. We must abide by those rules. We are different in that we alone provide the daily care for the people we support. We alone do all of the administrative paperwork for compliancy. Hiring supplemental staff is not supported in the current rate system, let alone the flat rate system, without exceptions, that has been delayed to 2028. In my written testimony, I wrote that 70% of us will close because we will not be able to meet the needs of the people we support. Are you prepared for placing the displaced population, knowing of the staff shortages that are addressed in DHS partner and providers' website? Are you prepared for the trauma that will be inflicted on the people that we support as they are removed by the state of Minnesota and put into other placements? Can you figure out where you need to go? I am a member of ARM and I appreciate everything that ARM does, but we need representation on this task force as Marsh. It is imperative that our voices are heard because the people we support have too much to lose without it. Thank you.
Thank you for taking the time to be here, and thank you for your testimony. With that, I'll move on to questions and comments from members. Not seeing any. With that, Representative Hicks, any closing comments? And then please renew your motion.
Thank you. I will skip closing comments because I know we're short and we have more bills. So I renew my motion to refer to the Human Services Finance Committee. I knew where we were going.
Okay. Representative Hicks moves to re-refer House File 3712 as amended to the Human Services Finance Committee. All those in favor signify by saying aye.
Aye.
Opposed, say nay. Motion carries, and the bill is re-referred to the Human Services Finance Committee as amended.